Good morning. You guys have been pretty quiet so far, except for this sign. So as Jacek said, last year, biology was a really hot topic. And so we thought that we'd do it again this year, that we'd bring it back and make it bigger and better than it was. And so we have we've organized a panel on what's happening. And as in some of the opening remarks, we're going to be having people on a panel that are talking about what it means to bridge the gap and what it means to facilitate growth. And in particular, bridging the gap between big data and the emerging needs in biology and computational biology. So what I'd like to do is just set the stage for that. All right, so I'm going to take about 10 minutes and share my view of the world and what it is that I think is going to be needed. So a little bit about the company that I'm with and what we do. I'm with GNS Healthcare. I'm the Chief Strategy Officer. We also do a lot of big data. Unfortunately, my colleague, who was going to be talking about some of the things and sharing examples of what we do in computational biology to build data-driven models of disease, herself got sick. So unfortunately, we didn't have a particular model that characterized what it is that ailed her, but she's getting better, and she wanted to make sure that she sends her regards and that she misses being here. So what is it that GNS does? Very briefly, we came out of Cornell. And so this was a group of computational physicists that knew everything that they thought they needed to know about modeling and set about building a lot of big data solutions. So what we do is we use a lot of data to build models directly and learn them directly, to model diseases, to model things that are needed by hospital systems, payers, PBMs, and pharma companies. So basically what we do is we can deal with anything that's multi-layered, dynamic, that has a real severe computational demand. And so what we're trying to do is learn directly from data. All right? Why is that important? Well, you guys have all seen these headlines. So big data has come of age. You can't read a newspaper anymore. You can't pick up the New York Times, the Wall Street Journal without seeing these kind of headlines. And these become real important. My role at GNS, I focus not on the biology and with biopharma. I am in talking with payers and health plans and hospital systems and pharmaceutical companies that already have drugs on market. And this is something that's become a very, very hot topic. And these are the headlines that are basically saying this whole topic is going to change the world. And it's going to change the nature of how these companies compete. And it's not just in industry in general. Big data is coming to healthcare too. And so this is where you guys come in. So it's making a tremendous amount of promises, and there's a tremendous need that's beginning to grow with all of these different types of data sources that are coming on the field. But the question is, why does any of this matter? And what I want everybody in the room to understand is that now is the time to do something about this. So if you look not at the biology and you don't look at the big data hardware aspects, we have a huge problem in healthcare. It has an absolutely crushing economics. We spend $2.7 trillion. There are estimates that say that more than 30% of that is wasted. We have a wave of people coming into Medicare that people, quote unquote, age in at the rate of about 8,000 people per day. Turn 65 and they join Medicare. And essentially it threatens the entire economy. What you see there in that blue graph, let's see if this is that the button right here? This basically is where we are today. And in terms of the growth, we have yet to actually even begin the climb of the number of people that are going into Medicare. If we don't change and to actually reduce this amount of spend and waste, this is, according to a report by Mary Milken, that said this is when the government essentially goes broke. All right, where if you take all of the money, if the United States were a company, so USA Inc., and you look at everything that we spend, we would consume, the only thing that we would have money left for were to pay interest on the debt and to pay for healthcare costs. That's it. And that year is 2024. So the point is that we have got to figure out ways to address that problem, and we're running out of time. And so when you think about all of the data that is coming onto the field and data that can be used to learn what actually works for whom, it's imperative that we bring a lot of the talent and essentially bridge the gap between the data that's coming and the knowledge that's needed. And so we have to find ways to learn directly from data. in terms of why it's possible, I'm not telling you guys anything that you don't know. This essentially is the perfect storm of soaring power and plummeting costs and the explosion in data. And why all of this matters, if you look at the healthcare system, essentially it is moving from a silo system, from 20th century silos, into truly trying to be a system, all right, in the systemness of things. Now, all of these things here, this is the way that a lot of people characterize the healthcare system today. Essentially, it's volume-based. And this is a lot of the things that everybody in the healthcare system is trying to work toward, to essentially be value-based. And there's a tremendous number of initiatives and changes in how the system is designed and reimbursement models, et cetera, but they all have some common denominators. And in this shift, they're all based, find value that is based on evidence, that's created from data, and to do it very quickly. Those essentially are the common denominators in creating this from-to shift. And all of those changes that people are making, whether you're a hospital system or a payer or one of these new accountable care organizations, the sustainability of all of those changes, even if they get them made, is going to demand a new capability. And it's the kind of capability that you guys are going to be talking about this morning. And it's the ability to create a deep and an ongoing understanding from data, not only of people's biology, but of treatments and which of those work, and in particular for whom. And that when you think about the crush of data that's coming, that really it's the only viable approach in a big data world. Okay? And with that, what I'd like to do is I'd like to introduce your panel for today. So briefly, we're going to be hearing from Titus Brown, who is with Michigan State University, and he's Director of Genomics, Evolution, and Development Lab there. We're also going to hear from Ted Goldstein with UC Santa Cruz, who is a PhD candidate in molecular engineering and bioinformatics, and also an entrepreneur and former vice president with Apple. And also Bob Grossman, who's with the University of Chicago, Director of Informatics at the Institute for Genomics and Systems Biology. And so with that, I'd like to bring up our first speaker, and that's going to be Titus. So please welcome him to the stage.